And welcome, Dr. Marmar.
It's a pleasure.
I've
Thank
been
you, John.
looking forward to sharing you with our audience, both here in person and joining us digitally.
I'm delighted.
Give you a little background why I'm so intrigued by the work and the mind that is Dr. Marmar. I've been involved with NYU Langone Health System for the last several years. And at the beginning of COVID, our board meetings became a lot more frequent and became remote. And I'm a note taker. So when I'm sitting listening to the speakers here today or on the board calls in a Zoom fashion, I'm taking lots of notes. And I go back and I look at my notes and I said, there's this one fellow, Dr. Marmar, who runs our psychiatry practice, who I'm taking a lot of notes on, and I'm quoting him often to the people in my personal and business circles. And so when this panel came up, I said, now I have a chance to get to talk to you in a non-Zoom setting and to share your wisdom and your insights with our audiences now and in the future, because we have digital and follow-up editorial that'll cover this. But when we go to the doctor, he'll do a couple of things quickly. He or she will do a couple of things to check and see indications of our health. As a prominent and eminent psychologist who runs a psychiatry practice across 7 hospitals that sees 50,000 patients a year, how do you take the pulse on where we are now? We've had this great accelerant. I don't think we were in great shape in terms of a mental health profile leading into it. What's happened?
So well, first, thank you. It's a pleasure to be here. And thank you for your wonderful work in your own business as a champion for advocating for and destigmatizing mental health problems. Mental health, and I have the privilege of chairing probably now at this point, the largest department of psychiatry in the country in terms of the number of acute and outpatient services we provide. Mental health really is a branch of primary care medicine. It is a specialty, but in fact, it should really hold a place next to family medicine, because mental health problems are so universal and challenging for everyone. I was a family doctor for a short period of time before I became a psychiatrist. And one of the things that I realized in my very busy family practice was that 40% of the patients that came to see me as their general practitioner, not as a specialist, were there for mental health related reasons.
40% of your patients when you're in general practice.
If I saw 35 people in a day, 15 or 20 of them, 15 of them for sure were there.
The root cause of their issues.
Either they were there directly because they said they were struggling with stress, anxiety, depression, alcohol, or drug abuse, or more serious problems, or they were there for behavioral health or medical problems, headaches, digestion problems, orthopedic problems, other problems, sexual dysfunction problems that had their origins in psychiatric illness. So in fact, the first thing for everyone to realize is that psychiatry, the problems of psychiatry and psychology are normal, pervasive through society, and pervasive in primary care. Now that was true before the pandemic. The population was struggling with that.
And
before,
now?
And the pandemic has dramatically accelerated.
And what indicators do you see that you point to? What KPIs are you tracking that tell you it's gotten worse?
Here's some very simple metrics. The number of patients presenting in psychiatric crisis to the NYU Langone General Medical Emergency Department has gone up around 100%.
Wow.
The number of patients seeking outpatient care has gone up about that percent. So we're seeing a doubling of the demand for people who are in crisis. That is, people who are struggling with suicidality or other very serious symptoms.
Domestic abuse, crazy.
Domestic violence, suicidality, escalation in alcohol and drug use. And we're seeing just a lot of general stress and anxiety. Now, what are the drivers? First of all, society, we're in a time of great upheaval and structural change in our society. The previous panelists were referring to that.
Yep.
And we have enormous challenges and wonderful opportunities to change the structure of society to be more equitable in business, for health to be more equitably available to everyone who deserves and needs. Those structural changes, though, represent growing pains, and that was happening before. Second, social media and technology have radically disrupted the lives of young people and everyone to some extent, and that has enormously increased the stress, anxiety, and depression levels in our primary school students, our middle school students, high school and college students.
What are we going to be saying now? You have twin 12-year-old granddaughters, and you have a 9-year-old grandson. What are we going to be saying 5 years from now about this 2-year interruptus? Let's hope it's capped at that, in terms of the impact on their development, social development, athletic development, academic development.
I think they're going to make it across the desert and get back on track. So I'm not so concerned about that. What I'm impressed with is at the ages of 12 and 9, their level of awareness of social injustice, social change, the need to restructure society, the wealth inequalities in society, the fact that a huge numbers of people, they say at the age of 12, that they see in their everyday life, huge numbers of people struggling simply to survive through the pandemic, and sometimes they see insensitivity on the part of the privileged towards them. So they're very aware of social media. They lecture us on empathic behavior. It's really remarkable. So I have great hope for the future. But if you look at the major trends, the disruption of society through technology at every level,
Every aspect of society, social, business,
family, education, every aspect is profoundly disrupted. Social media has profoundly changed the way children connect with each other, socialize, and
it's not all bad, right? It's good and bad.
It's interesting and important and stressful, and those things were happening before COVID and other major changes. Now, what about COVID itself? I was looking at the data just before I came in, Jim. According to the New York Times, in the past 20 days, 801,000 Americans have died from COVID. Now, that is probably at least a 50% or more underestimate, because the 800,000 Americans have COVID on their death certificate, but another 50, maybe another 400,000 or 500,000 have died because COVID triggered a series of medical changes that ultimately resulted in their untimely death. So we have at least 1 to 1.3 million Americans who have died from COVID and COVID-related causes. Now, my colleague, Naomi Simon at NYU, has done some research in bereavement to show that for every death, there are at least 9 or 10 family members and close friends, on average, profoundly impacted by grief.
That's 10 million people
who
are suffering from grief right now.
We have 300 plus million Americans. We have 10 million who are bereft. Okay, and not just bereft in the normal sense, but bereft under very difficult circumstances where they may have been separated from their loved one when they died, when funeral rituals were disrupted, when social networks were disrupted. The major way in which people cope with grief is through love, friendship, support, religion, comfort, and that's all been disrupted in COVID. Right?
And that's all aided by the rituals that we've developed across the different religions on how we celebrate a life and how we bring closure.
Honor a life, celebrate.
But those have been disrupted. There isn't the service. We don't travel across the country. So I have the grief, but I don't have the rites and rituals that help me to deal with it.
You lose someone, you lose a wonderful friend or or worse, a family member, and you join a Zoom funeral. That is completely the antithesis of how grief has been managed since at least Egyptian culture.
Yes.
So 4,000 or 5,000 years of tradition of how to comfort the bereft have been disrupted. So
Not that I have an interest in this, but we do know that Neanderthal man was buried in a ritual that included flowers. I'm just saying.
Jim,
Pre-Egyptian.
Jim, a genius of marketing can never be stopped. So yes, flowers.
But during one of those board calls, two things you said that stuck with me, and we've chatted here with the Techonomy and Worth and CDX teams about it. You said the good news is we're very busy in the psychiatry department. The bad news is we don't have to go outside our doors to find people who need our care. There are 46,000 people who work for us here at NYU.
Yes.
You told me earlier today that your concern about the impact of this wave of COVID isn't on being flooded at the hospital with patients because they don't seem to be getting as sick, but they do have to isolate, and the consequences on your staffing.
Yes, I think for the moment, I'm asked frequently, as you asked me this morning, what do you think the effect of the Omicron variant is on our healthcare system? And it's a little too early to say for sure, and that's not my primary expertise in infectious disease and communicable disease. But what I would say in speaking with our specialists are, and as we read and learn from the European and Israeli experience and South African experience, it looks like Omicron is super infectious and not too pathogenic. That is to say, will probably not result in a large number of very ill patients. However, it's going to rage through the American population in January and February. The result of that will be a tremendous pressure on COVID testing centers, and a very large number of us, including those of us in the room today, who are going to flip to be COVID positive again, even if we've been fully vaccinated and boosted. Now, what's the effect of that? And fortunately, it doesn't look like we'll get very sick, but we will end up being isolated. So the question is, in our case, NYU Langone Healthcare now with 46,000 employees taking care of millions of patients across Manhattan, Brooklyn, and all the way out through Long Island, will we have the doctors, nurses, technicians, lab techs, receptionists, patient care techs, everyone you need to run an enormous healthcare system? Will we have enough to maintain the fighting force? And how will we, let's say we dodge the bullet of a lot of people in the ICU,
Yep.
It looks like that. How will we take care of all of the other patients who have normal healthcare needs if we don't have sufficient numbers of healthcare providers? That is a very, very imminent concern with the Omicron variant.
If I know you're a student of history, and I was intrigued by what you said recently about this. But let's look at, to predict the future. You guys are real good at predicting the future. I think Dr. Bob Grossman said some things in April and May of 2020 about the future of healthcare that have come blazingly true in fast order. I know you're a part of that think tank that thinks that way. What lessons do we learn from history about how do we expect the future to unfold?
Well, I think one of it's interesting that the last presentation was on a woman expressing concern about her college age student about being a history major. I spent most of my career at the medical school in San Francisco before I was privileged to come here to NYU. I was vice chair at UCSF before I came here. And, several of the Nobel laureates in medicine at the University of California, San Francisco, including the ones that discovered the gene for cancer, the oncogene, were history majors in college.
Is that right?
Yeah, so I think that
Add that into that data set.
I think that a good education in critical thinking in history is fantastic.
Yep.
I would have liked to have had Henry Kissinger as my professor, but that because he taught me how to think about evidence in the social sciences. But anyway, the question is, what can history teach us about pandemics? The most interesting thing is, if you study pandemics going back several thousand years in history, every major pandemic has disrupted social order, and usually in a positive way. For example, there are scholars of the Renaissance that believe that a major trigger of our emerging out of the Dark Ages into the Renaissance was the Black Plague.
Mhm.
And the Black Plague took in the 1300s,
Yep.
which took an enormous number of lives in Europe.
Huge percentage of the population.
Yes, huge percent of the population, a third to a half of the population, and did something else. It destroyed the ironclast grip of the church on society, and it did so because large numbers of the population questioned a benign and loving and just God in the face of these mass losses. But for one of the big impacts of the plague was to shake the social order and allow science and literature and the arts to flourish and escape the oppressive control at the time of the church against those developments. So we saw the plague result in some significant measure in the Renaissance, and we're going to see this pandemic result in social equity and social justice.
Interesting.
In part,
Even from the bad, something good can come from it.
I think that there's an enormous potential for good. Listen to the last presentations, how riveted we are
Yep.
on social equity, diversity. Those have been percolating in our society for decades, and they're going to explode in part because of the disproportionate pain borne by those who are socially disadvantaged in the pandemic.
You were commenting to me recently about, this is a pandemic that has two very different impacts on the population. You have access, you're comfortable, you have resources. It's tough, there's going to be losses, but it's not going to shake your fiber. And you can isolate if you need to. But if you're a working class person, you can't avoid getting on the subway or the bus. You have to go to work. And that's had a very, very different impact on the socioeconomic stratus.
Tremendous risks taken by frontline workers. This is saying the obvious. Food insecurity, housing insecurity, health insecurity on the front line, direct risk from COVID before we had vaccinations and medications. So it's, and disproportionate, we talked about bereavement, disproportionate grief in the Black and Latinx and other communities. So those are very important. I don't think it's an accident at all that there's a resurgence of the Black Lives Matter movement arising. That phoenix in part is arising out of the ashes of this pandemic and is overdue and very important. But this pandemic will accelerate social change in our society, and the evidence for that is every previous major pandemic has done so.
I asked Dr. Marmar the other day, I said, what would you like us to take from your discussion with us today? What's the takeaway we should all have? And you said empathy, and it's about what you're talking about now. But please, I'm going to embarrass you. Share a little lesson you got in empathy from those two precocious 12-year-old granddaughters.
Yes, we were spending some time together on Thanksgiving, and I was very pressured as usual, juggling a lot of things, and we got into the Uber, and I think I was somewhat unkind and impatient with our Uber driver, not wanting to be or even necessarily consciously aware of getting to the venue we came to and being impatient with the person that was taking our tickets to get up to this brand new event called the Summit at One Vanderbilt close by here, which is fantastic if you haven't been there. And my darling granddaughters have been tracking, monitoring, and measuring my empathy level towards everyone in service roles, and they gave me hell about it. And they connected me with telling me that if I don't know what being a Karen is, I should find out quickly. And you can be a male and be a Karen and clean it up. And it's very interesting. My wife was a little, understood, she was a little taken aback and said to one of them, Amalia, said, Amalia, with all due respect, you know, when you've lived as long as I've lived, you may know more than you know and have a deeper perspective. And Amalia's 12-year-old response was, living long does not guarantee repeating the same mistakes.
Well, Dr. Marmar, it's been my privilege to introduce you to my friends in our community here. You're a fantastic professional, an unbelievable human being, and we're so lucky to have you at NYU Langone Health, and I'm so happy to share you with our audience.
Thank you so much.